Hi everybody and welcome to TNT. It's a Tuesday. It's a very wet Tuesday here in PHANG, Thailand, trying to bring you up to date with some of the stories around the place. Now, this is one of those topics that I try and avoid, but it has been in the news quite a lot, and it would be, irresponsible of me if I didn't even address it. It's got to the stage where I think it probably just needs a comment and a bit of discussion. So, we're talking about Covid-19. Covid-19, that's 6 years ago. 6 years ago. So we'll start with The Nation and their story from nationthailand.com. Thailand reports over 20,000 Covid-19 cases in a single day. Now this story, written back on June the 5th, we'll have a more up-to-date story in a moment. But Nation Thailand reported last week that 20,000 Covid-19 cases were reported in a single day, mostly around Bangkok. Just further down, new cases, just over 20,000. Total accumulated cases this year, 351,000. New deaths, 3, bringing the total death toll to 76 from January up to the present day. And where have these cases been found? Principally Bangkok, Nonthaburi, Chonburi, which includes Pattaya, Saraburi, which is north of Bangkok, Ratchaburi, which is just southwest of Bangkok. So most of the cases being reported around the capital, which, population-wise, isn't a surprise. And the age groups affected, given what we know about COVID-19, mostly people over the age of 30 to 39-year-olds are the principal sufferers in this latest outbreak. And not surprisingly, here in Thailand, the department urges the public to wear face masks, wash hands frequently with soap and water or alcohol-based sanitizer, avoid close contact with elderly individuals over 60, that includes me these days, and those with underlying health conditions to help reduce the spread of infection. And so before you start getting all triggered and lubing up your keyboard, let's just get through the rest of the story. We go to the Bangkok Post. And their story, COVID spike, a cause for concern, according to a Chulalongkorn University professor. And this story was published yesterday. And that is the Chulalongkorn University professor. You know that because he's got a pen in his pocket. And the story says in a post on his Facebook page, Dr. Tira Waratanarat, an associate professor with the university's Faculty of Medicine, said the rapid spread and spike in COVID-19 cases should be a cause for concern. And the concern, more than 400,000 people have sought treatment for COVID-19. That's not counting those who were infected but chose not to seek treatment at hospitals. So 400,000 people since the start of the year who felt sick enough to admit themselves to a Thai hospital. And COVID-related deaths have exceeded influenza-linked deaths threefold. Plenty of influenza still around. I've just had a bout of it, but COVID deaths 3 times the influenza deaths. The widespread presence of the virus in both urban and rural areas, combined with the emergence of the highly infectious Nimbus strain. And just noting here, it says doctors are warning anyone with a razor blade throat they could have the new highly contagious COVID variant. And back to the article, it's blaming declining immunity, minimal preventative behaviour and a high number of elderly people in Thailand, which ends up in a rapid spike in infections likely to happen. And the professor rejected the misleading narrative which claims COVID-19 is now just like a cold or the flu. And that did become one of the common myths spreading around. Oh, it's just a mild cold. Well, a lot of people may have had a mild cold or no symptoms at all, but a lot of people got very sick, and as we know, millions died. And Dr. Tira warned that this combination of risk factors creates a setting ripe for a massive outbreak, especially in high-risk venues such as schools, universities, offices, nightlife venues, childcare centres, elderly care facilities and prisons. So this is not fear-mongering. There is a statistically relevant story there that you deserve to know about. Now, you may be over 60, you may be immunocompromised, you may have a history of respiratory diseases. You probably just need to take a little bit of extra care. Now, beyond that, I'm not going to be doing much more on the story until we see some more numbers that continue to make it an important news story. But I suppose we just need to be aware, maybe even alert, but not concerned. We know exactly what to do with COVID-19. If you do have a case of it and you need to get out and about, well, just pop a face mask on. That reduces the possibility of you passing it on to other people. Beyond that, go and seek advice from your local doctor or medical practitioner. Don't seek advice from a Facebook page. Hopefully you're now up to date on that story. Thanks for watching. Please subscribe to the channel. See you next time.